All right, welcome back. So let's discuss what is the AFK exam. This is your first step after applying, and this is the first exam, and this is the one that you want to focus on the most to get the highest mark because it will open more opportunities. So this is short for the Assessment of Fundamental Knowledge, okay? And there's 300 multiple choice questions, okay? So you have 150 questions in 3 hours to do those 150 questions. Now, recently, they made it a half-hour break and then another 150 for 3 hours. Okay, so they made a half-hour break when they made it online. So now the exam is actually in Prometric center. So you're going to do it online on a computer, not like before where it was on paper-based. Okay, so this is a new thing. It's going to be first time to try this technique. And they tried it with the ACJ a year ago. They started this with the ACJ a year ago, and there were kind of problems with it. So some people's computers would just kind of not work. Some connections would just get messed up. So unfortunately, some of you may be lucky or others will be unlucky with the center, okay, or the computer, unfortunately. However, it is new, so they may have these kind of software issues with it, right? And obviously, it's going to be Prometric centers in Canada, a bunch in the US, and even in Europe. So you don't even have to do the exam in Canada, right? If you're anywhere in London, what I know is that they had a center in London, Paris, even in Belgium, Hong Kong, Australia. So there's centers all over the world. Once you apply for the AFK and you're approved and everything, they'll show you what centers are available at that time. So they might have some closed and some open, depending on the case at that time. Maybe depending on how many students apply for that location too. Okay, so that is the protocol or the structure of the exam. So how do you prepare for this exam? Well, I'll tell you the first way is to take a course. Okay, we'll help you prepare for it. If you're not taking a course, basically, even if you're taking a course, the focus is on released questions and review books or materials, right? So released questions means the NDEB has a set of released questions that they put on their website. So they might have 2019 released questions, and there might be in there like 400 pages of questions. Pages, not 400 questions, pages of questions. Each page may have 7 questions, and a bunch of review materials and books that we're going to talk about. So just to tell you, there is something called released questions, okay? Almost every year there's a new release. So for example, 2016, there was a released question document or PDF, okay? That had 300 to 400 pages, okay? 2015, there was also a PDF that had, now here's the thing, they are almost the same. Almost same questions, okay? But most of the time, there may be 200 to 300 new questions in the new PDF. So you might find maybe 100 to 300 new questions. However, they don't usually put these questions at the end. It's just all in there somehow, randomly. So we always go through and compare the 215 with the other one, and we extract the 200, and that's also taught in our course, okay? So we do that work for you. Or even sometimes students would get together and help out if we're really crunched, but we do it now for you, don't worry. And now 2017, you're gonna have PDF, another new 200 questions maybe. So we have to go in there and find the new 200 questions are inside the 400-page document, right? Now, currently in 2020, the NDEB did not release a new question set, so that's good. That means you guys are still using up to 2019, which is fine. So this is also important because when you use the PDF that's from the NDEB, it's kind of hard because they're not organized, right? It's just a random document. You've probably seen it with question, 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 question. So it could be any topic. You might see this question. Oh, this one. Oh, it's old question. This one is already from it's repeated. I've already read this question before. Oh, here's a new one. Here's, oh, this is an endo. Oh, this one is surgery. So it's like that, and you don't know what you're getting. We organize this all for you into subjects, okay? It's all organized into endo subject, surgery. It's all organized in the course. Here's a sample of what the questions look like. So you have questions that look like this, which is one straightforward answer. So you could look at this question. I mean, I think all of you know the answer. What do you guys think the answer is? I'll get to that. So Mani Deep is asking, will the questions only be asked from the PDF? No, no way. Okay, so that's what we call release questions. Okay, these questions have to, by the end of the course, you have to become an expert in them. Okay, they will become easy for you. So in the actual exam, you might get 20 to 40% from the released, from this PDF. So when you come by them in the exam, you better know them very well. You don't need to waste time on them because you have a bunch of other new questions that you might have. And those questions, the other 60 to 80%, a lot of them are going to be similar to what we have in our mock exams. And then there's going to be, let's say, maybe I could say like maybe 20 to 30% like super new, brand new questions. And those are the ones that you want to spend your time thinking about, okay? So back to this. The answer here is actually strep mutans because the recent research says that the etiology of caries on a root surface is actually the same as the one on crowns. So I know the old concept used to say actinomyces, but strep, because of that, they found that no, actually it's still the S mutans. The etiology is still the same. Anyway, we're not going to go deep into teaching right now, just the concept. And you have other style questions that you'll find in the PDF that look like this. We call these multiple of multiple. So you'll have 4 options, and then you have to combine the correct, which ones are correct. And it always comes like this: 1, 2, 3, 1, 3, 2, 4, 4. It's always like this most of the time, okay? So, in this case, well, I don't really care about the answer here. We'll talk about it in the course when we get to it. But the concept is these do not appear in the exam anymore. All right, so you don't have to worry about this style. Okay, so what is the thing here? In the PDF, you will find questions like this. So in the course, we will study it. Why? To learn. But just know that it won't come in the exam. Okay, so what they will do is, okay, how could you make this question an exam question? Okay, so this means this is right, this is right, this is right, and this is wrong, right? You're with me, guys? Okay, so that means what I'm going to do as an examiner, I'm going to delete this, right? And I could say all of the following are true in root caries risk in adults, except. Done. Now, you just have to choose this one. So they could take, we call these, Dr. Haj and I actually call these modified released. Okay, that's what we give them a name. We call them modified released. So it's a release question, but just modified. So it shouldn't be a tough one. Okay. We will talk about that soon. No problems. But we need you to just follow with me here. I have slide by slide, right? So we have to move through the slides and then we'll get to all these questions. Okay. And then I'll take your questions after. Just try to focus your attention on what I'm saying right now. Because I know, here's another studying tip, guys, to pass this exam. Focus on what I'm teaching now, not on what you're thinking ahead. Okay? Focus right now what I'm saying. And then if by the time I'm done, I do not answer your question, then I recommend everybody get a pen and paper. And if you have a question, write it down, but focus on what I'm teaching right now at this moment, okay? Because you might ask a question about this later, right? And then at the end, if it's not answered, we'll go through your questions, everyone, okay? All right. So, and also there's a way of bringing this multiple of multiple without actually bringing the multiple of multiple. So option A could be like maybe cementum and dentin. Option B could be cementum, dentin, enamel, for example. So it's kind of like a multiple of multiple, but in a different way, right? But still, it's more comforting not to have it. So we will still learn it because you want to learn what's inside the PDF, basically, on these questions, okay? Now, yes, you won't find the old PDFs on the website because you don't need them. Anyway, the summarized version of all of these questions basically will be studied during the course. So you don't have to worry about that. You don't worry about getting it yourself. For now, you could only get to 2019. Okay? Okay. So how do you want to think about the AFK? This is very, very, very important, guys. Please focus on here. Okay? The prometric exams for both now. AFK and ACJ. Just answering a question that was in the chat. Okay. We need to put you in the right mindset, okay? You have to have the right mindset to pass these exams. If you don't, you're going to put yourself in a problematic situation. So please enter the course and this exam with this mindset. First of all the questions and concepts about dentistry and about this exam, there's going to be 95% that there's consensus of. What does that mean? We're sure of it. Okay, whether it's by evidence, whether it's by our own judgment, we're sure that this is the best answer. There's always going to be 5% controversial questions that are confusing, but we will give you what our answer is, our answer. But you cannot really confirm it with evidence, and another option may be debated. Okay, what's the problem here? The problem is what we see, the students that don't make it, they put 95% of their mind and effort and thinking into that 5%, and they only put 5% maybe into the 95%. Okay, I mean, that's just kind of numbers to make it look cool, but I could say even if it's 50-50, let's say you put 50%, that's even bad. You want to put almost 100% of your effort into the 95%. That's what you want to do. And don't put any effort into the 5%. We'll give you an answer for them and just memorize it, right? If you want to go 95, fine, 5, that's sure fine, do that. But and let me walk you through this concept, what happens here. Okay, I'm going to try to walk you through the student mind while you're taking the course. Okay, so let's say I'm answering questions for you. Okay, so there's question 1, 2, 3, 4, 5. Okay, oh, I have the answer. I'm explaining it. I have the answer here. I have the answer. All of a sudden, this one is controversial. There's 2 options that may be the answer. We give you our answer. Now, you, the student, what the mind does is that says, oh, these are guaranteed. So I'm just going to put these here for a bit. And I'm going to take this one and put it here. And I'm going to focus on getting the right answer for this. Why? Because I'm a perfectionist. Right? Perfectionist. So I want to get 100% of my material. I want to collect 100% of everything. I want to make sure. And you might think perfectionist is a good word. It's actually, I don't look at it as a good thing. I look at it as this is a problem. It's not necessarily good to be a perfectionist. Perfectionist means you don't know when to stop. You don't know how to limit yourself. You don't know how to tell yourself, hey, you don't have to be 100%. You need to know what to do to get the best thing you could get. And that sometimes requires you to say no to yourself. So what happens is you start focusing on this question, researching it. Honestly, I'm going to tell you, researching question could take you hours. Okay, Dr. Hajar could you know, testify to this. Dr. Hajar, how long could one question take sometimes if you put in a, like, if you research a question, how many articles? Days. Dr. Hajar has done a lot of research. Days. Okay. How many articles would you have to read to try to get an answer sometimes for a question? Geez. Okay. So, okay. 25. So, and books. And I know this because I do research too, along with this stuff. So the reason I'm telling you this is we've already done all the research we can to find the answers. And after the research, yes, you'll have 5% that has no answer. Sometimes you find a reference that will support option A and another reference that will support option B. So there's no solution. Sometimes you'll never find a reference and there's contradicting information. So if we put all this effort in and it's still controversial, and we're telling you that you want an instructor and a course that is transparent with you. We're telling you it's controversial. We will give you the answer to go with. And sometimes we'll tell you you could go with this or that depending on what you think. But you shouldn't put effort into it. Don't go researching it because you're going to waste so much time. There's no time for that, okay? So these questions that we tell you, just memorize them. Don't put time into them. You have to trust us, okay? You will more likely pass if you assume everything is right by us. It will be easier. But if there are things that you think are wrong, you could talk to us. We'll talk about that later. But these controversial ones, we'll point them out. We'll tell you this is the 5%. We did all the research. And if you're going to go do these days of research, you might end up with the same position anyway. Okay, so that's one of the things that is really, really important about this exam. No, don't research. That's what I'm trying to tell you. Okay, so again, we don't recommend that you need to research the controversial, but we're going to talk about this later as well. Now, here's another way of looking at this. So this is a locally kind of thought. Now, I'm going to try to put this thought in a timeline. Okay, imagine you are this perfectionist person, okay, and you're trying to get all the questions to be 100%. You have to remember one thing, okay? Our course is more than 4 months now, so let's just say it's months, okay? The course is a moving train. This course is not going to wait for one student to get what they want, okay? This is how the course works. This is how courses work. You can't, a train is not going to wait for you. We have a schedule. To be efficient, to get you the best result, we have to move on that schedule regardless, okay? So we have a schedule that we have to complete, okay? And actually in another way, okay, think that you're on a train. And I'm not the best artist when it comes to trains, but think you're on a train. Does a train look like that kind of? Has this kind of circle here? Okay, let's just say that's a train. Okay, and you're going through this beautiful kind of, area in this train. You're going through a lot of cool sightseeings. Now, here's the thing. If you decide that you want to get out of the train and take all these cool selfies, right? Take a selfie of yourself, you're going to get better photos, right? You're going to get better photos because the other person inside the train is just looking throughout the window. They're getting a view. They're getting a good view of the beauty. Okay, good view here. We're getting the good view. We're seeing what's outside. This person is getting amazing photos out here. He's perfecting the photos. Perfectionist here. However, the train is not going to wait for you. Okay, the people in the train get a good view of the whole ride. This person is going to miss out on what's over there to see. Okay? If you spend too much time in one area to get it perfect, you're going to miss out on the other area. If you're in the train and you're okay with not everything being perfect, getting good view of everything, that's what the exam requires. The exam does not ask you to be a dictionary, doesn't ask you to be a library. You don't have to get everything perfect, but you have to know what you need to know. Okay, you have to know what that area looks like and what this area kind of looked like. You could a little bit, right? So similarly in the course, we're going to give you the first weekend. Okay, our first weekend is basic science, right? The amount of questions are probably around 400, I think, right, doctor? Or 400 questions maybe in basic science, with material plus books, right? So questions and books. 95% of it we're sure of. 5% is controversial. Take the 95, finish it, move on. Okay, even if there's parts of it that are very difficult, sometimes I recommend skip the parts that are really bothering you. If there's a page that's inhibiting your moving forward, skip it. Put a mark on it and skip it. But you want to get the 95, even if you put 90, and move forward so that the next time you get the new set of questions for pharma, you're ready to take it, and you get to 95. Okay, 5% I'll memorize. Get the majority of it if you can. That way you'll stay on the train. By the time you get to the exam, you'll be at your maximum efficiency. You'll have 95% of everything covered. Because trust me, studying the 95% may take you as long as studying the 5 or researching the 5. Okay, so focus on the majority of the concepts in the thing. Let's look at someone that's trying to perfect it. So basically, if you do the 95%, okay, you might not be at 100%. Let's say the blue is everything that's being given. Okay, 95, that's still good, right? That's really awesome. That's like saying you get 95 on the exam almost, right? If you know 95% of everything, then you'll get 95 probably on the exam. Like you'll get a good mark. But what the concept is, you have to really study it well and review it, right? Because just because you study something once doesn't mean you know it. You have to study it multiple times. So 95, one study, one study, one study, one study. Then you have to somewhere repeat these parts, right? So that you could, when you reach here, the 95% is in your mind, fresh all at once. Now, if you try to perfect that last 5%, look, okay, you'll perfect it. Maybe the first subject, you're going to be perfect. You're going to perfect basic science. You're going to get 100%. You're an expert in basic science now. Okay, but it may take time from the next one. So when you get to pharma, now you have less time, and you start not having time. You start to lose time, and all of a sudden in the last subjects, you'll be delayed. You'll be under, because you're always pushing things forward. And by the time you get to the exam, okay, maybe your first things are okay, but your last things are not. And not only that, you probably forgot what you did here, because you're stressed. So stay on our train, stay on the train, move with the course, and don't let the difficult questions or the controversial concepts take your time. Okay? So what's the conclusion here is that you want to focus on the 95%. Okay? And how do you implement that? Okay? Read the confusing. So if there's something confusing, okay, it could be a page, could be a question, could be a table, whatever it is, read it, then move on. Okay, just you want to study it, but if it's really you're not getting it, just move on, right? You could ask questions about it later. You could try to get help with it later. But read it and move on. If a question is subjective, you may never confirm an answer. Okay, if there's a question that's subjective, you may never confirm an answer. So don't waste time on trying to confirm an answer. If a question has two options which can be confirmed with a reference, what are you going to do? If option A, there's a reference that supports option A and another reference that supports option C, okay, what are you going to do? Are you just going to keep researching? No. You know what I do? Move on. And if it does come the exam, because it may not come in the exam, but if it does, then I'll choose. I'll choose one of them. No problem. These are not the questions that cause you to fail. Back to this here. We have this idea that we think the exam is going to be full of the 5%. That's not how it is. They might bring a few questions of the 5%, but it's not all the controversial questions are going to be in the exam, right? So it's fine. Let it go. Let that 5% go. I'm more than happy to, you know what? I'll focus on the 95. Those 5%, if they come to the exam, let them be. I'll miss those marks, right? As long as I make sure I get the rest of them that are doable, right? And that way you could guarantee a good mark. Okay. Now the course will help you speed up this process, because what's the issue here? If you're studying alone, you don't know which question is controversial. So you might find a question and you might start researching, and then it takes you days, and then you figure out, oh, this is a controversial question. Okay, so I'm not going to spend my time on it anymore. But you already wasted days. Question 2, oh, look, you found the answer. You spent days researching, but you found the answer. Okay, this is not, I have confirmed the answer here. Good. Question. So the course, we already know which questions are controversial and not. We already done the research. We'll show you evidence for each question that we found. So our course will tell you this question is controversial. Don't waste your time. This question, we know the answer. That's going to speed up your process. That's going to save you time. Okay. All right. So what are some reading materials for the AFK? Basically, we're going to provide books when you take the course, Scholars Dental Materials. Okay. We have basically 4 books that are that compile everything. Now, some reading things are Dental Decks Part 1, Part 2, MOSB, First Aid Part 1 and 2. Now, my personal recommendation, that's just me, if you're not taking a course, is Dental Decks Part 2 and Release Questions. This is my, just if you're not taking a course. Taking a course is better. If you take our course, you're going to get better. You're going to get everything you need. But if you're not taking a course, I would recommend these 2 things. You're just going to put a lot of time into it. Okay. And the thing about Dental Decks Part 2 is that there's a lot of info, but it's somewhat random. So you need to read it at least 4 to 5 times. Okay. To get that info retained. So for example, and now if you take the Scholars Dental course, you do not need to read anything else. There. Okay. We have all the summaries from MOSB, Dental Decks, Release Questions, and even textbooks, whatever it is. We found what we need to get you to the level you need to be. Okay. So what's an example from the Dental Decks Part 2? Dental Decks Part 1, by the way, is focused on basic sciences. So there's a lot of chemistry, general anatomy. I really don't recommend it unless you're doing the, well, no, I don't recommend it. The Part 2 would be the better one to focus on, because if you do both, you're gonna waste too much time. So pathology in the Dental Decks, it needs repetition and organization, but there's a lot of info there. It just needs some repetition and organization. Obviously, in our course, we've already done that. Everything is organized, and you know, we're gonna help you even do it with the repetition. I have a strategy in pathology that will help you memorize pathology. Perio, for example, in the Dental Decks, it has good info, but it's so hard to understand. It needs explanation. People that read flaps from Perio in the decks are always so thankful when they see our videos. When they see our Perio lectures, they're like, oh my God, we actually understand flaps now. So I'm really happy about that. Pharmacology. I would say in the decks, it's not really good for beginners or first timers. It's good to review from if you're an expert, but honestly, we really changed the game in pharma here. When you take our course in Scholars course and you learn pharma, you'll find that the decks all of a sudden become they make sense. They become easy. But when you start with the decks, it's difficult. Dental materials in the Dental Decks is actually lost. There's no section for dental materials. It's part of restorative and prosto. So it's random cards here and there. We have a subject, a whole weekend dedicated for dental materials, and it's one of the best things. Like, we made dental materials something that could be understood. Okay, as dry as it is as a subject, it's pretty proud of it. So we have, this is how the decks look like. We're just telling you that there are some sections of the decks that are good, some that are not too great. Okay. Okay, courses. Again, about the courses. So the question that we get asked, can you pass without a course or without courses in 2020? Now, if you asked me this question in 2012, I would say yes, you can. Now in 2020, very, 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 very difficult. Okay, why? Why did this happen? What do you think? What do you guys think is happening? Well, I'm going to tell you. Okay, first of all, this exam is competitive. What I mean by that, the marking system is a scale system. So you want to imagine that it doesn't matter what your mark is. Okay, what matters is, are you doing better than other students? Okay, so the exam, okay, yes, they say the passing mark is 75%. That's the passing mark. So you would think that I only have to get 75% of the questions right? Which means 75 times 3, because it's 300 questions, right? How much would that be? 150 plus 75, that's 225. So you think, okay, I'm allowed to make 70, and it's a good guide. It's a relatively okay guide to think, okay, I'm allowed to make 75 mistakes, right? However, that's not actually your mark, okay? So if, let's say there's, 1,000 people taking the exam, what if 800 people get 79? You think they all pass? Right? Or 800 people get above. What if 800 people, let's say it this way, answer more than 225? Do you think they all will pass? No. So what they do is they reduce your mark. Okay? If too many people pass, they will reduce your mark so that it is under 75. Okay? Because they want only a certain amount to pass. So maybe they want, let's say they want 40% to pass or something, right? So they have equations to do this. I don't care about the equations. And you don't want to waste your time on that. Okay? Now, let's look at this again. What if only 100 people pass? So 100 people solve these. You know what they'll do? They'll push the marks higher than 75 to get more people passing, so that they get maybe 30% passing. Okay, so what does this mean? This means that you have to be top of your batch, right? You have to be better than the students that are taking your exam. Does that make sense, everyone? Okay, you have to be, if there's 1,000 people taking your exam, your AFK exam in your year, you have to be top, let's say 25%. You have to be the top of those students. The NDEB only wants the top, the best of the best. Okay, they want the best percentage. They don't want just to allow everybody to pass. They want to go like, who's the best 25% of these? And this makes the exam always kind of the difficulty of it is no, you don't need to know how they you don't need to know anything about how they do this equation. All you need to know is how you could be the best. That's all you need. And the way to be the best is, well, let me tell you here, okay? Let's go back to this slide. In 2012, not many, let's say there's 1,000 people taking courses. 1,000 people taking the exam. How many do you think were taking courses back then? Let's just say maybe 40. Like, there was a lot of people taking courses at that time. However, with the whole competition and growth, you could probably bet that at least 300 to 400 students now are taking courses. So back then, if you didn't take a course, you still had a chance to be included in the passing, right? These 40 may be the best, but they're going to allow more people to pass. You see what I mean? So they'll lower the standards. But now the bar is going up, which means if there's 300 people taking courses and you're one of the people that are not taking a course, what makes you think you're going to be better than them? That's probably going to be enough people that the NDEB wants to allow passing, and then that's it. They're not going to take any more. So the concept is, I want you to be realistic here, right? Not a superhero, not a lone wolf thinking that you could do it on your own. If you're on your own, studying, researching, doing all the things you can, okay, and there's another student here with a group, having a guide that's experienced, right? Let's give him some glasses there, even though I don't wear glasses, but just saying, okay. But okay, teaching them what they need, helping them understand. They're in a group, they're getting weekly quizzes, forum support, mocks. Do you think you're going to be in a competition with one of these students? Now, I'm not saying everybody here in this section is going to be better. Sometimes there are students here that don't put effort. They just simply, they do not put effort. They're not taking it seriously, right? But if you have the same effort, let's say effort equals X, and this one also is putting the same effort X, who do you think is going to be the one to get a higher mark? You have to be realistic. Now, unless there's like some lucky, but most of the time, this person is going to be at a way more advantage than this person. Okay, it's just guys, there's no debate, right? There's no debate. So if you have 300 of these, right, from all different courses, okay, and you have 700 of these, I mean, maybe if the NDEB was nice that year, they would probably, you know, allow 50 of these people to slip into the passing, the 50 top. But, you know, you're risking more. More people are taking courses. That's why I think in 2020, I wouldn't recommend doing this without a course, because you're just losing time. Your time is money. You're losing your potential to become a dentist faster and starting your life in Canada, right? Here's another thing, okay, that I need everybody to understand as well. You need to reach, what do courses do as well? You need to reach a certain point for you to pass. So you need to reach your best potential. Now, everybody may have a limit on what their best is, right? A course will help you achieve that point more efficiently and faster. It's not going to be the same for everybody, okay? Because the journey will depend on your own pace for each individual student. So for example, let's say you are student A, okay? Without a course, maybe you need 1 year to pass. Now, you don't know this. No one knows this about themselves, but let's just say your potential needs a year. Taking time, studying, your intelligence, maybe your memory, how much stress there's in your life, all this stuff. Are you working? Maybe you need a year to pass. A course may help you pass in 6 months, right? For example. Okay, student B is different. Maybe student B, without a course, actually has a lot of time. There's just, they have a lot of knowledge. So maybe they need 6 months to pass. Okay, a course will make them pass faster, maybe in 3 months. Now you might think, well, wait, the exam happens every 6 months anyway. So that means you'll get a higher mark. You'll be better. So the concept is, do you want to risk just getting, you don't know what and how long and nothing? You just don't know, unknown? Or do you want to know that you've done the best you can for yourself? And that self, so let's say someone needs let's say someone needs 1 year to pass, let's take another student C, okay? And they need, let's say, no course, 2 years to pass, okay? So they take a course and they need 1 year to pass, but they take the exam and they might fail. That could happen because they needed 1 year. 6 months wasn't enough. So they need to take the course again and then pass. That's fine. But this person, you're always going to be better. Your version of yourself is always going to be better with a course versus no course. So if you failed even after taking the course, it doesn't mean the course did something bad, especially that if there's other students passing. Like we have 93s, 90s. Dr. Hajar was a student of the course and she got 90, right? So the course is doing what it needs to do. But if your own individual situation and you failed, it's not the course. It's mainly that you just needed more time. But whatever it is, the course is making it faster. And you have to have confidence in that. It's 100%. There's no debate on this. Like support, help, guide is better than none, right? So I think, but I need you to understand this so that you understand what you are getting yourself into, the journey, right? Which one are you? Are you student A, B, or C? We don't know. However, you're always going to be better off with support with the course than not being with the course, okay? So you could be assured that you will be, you're speeding up your own process, whatever that process is. Okay, so that's my recommendation. Take the course, okay? If you're doing the AFK, take the course. Don't wait until you fail, please. The most stressful is when you come to me at your third try, say, Dr. Hafez, this is my third try. What do I do? Take the course. That's what else can take the course twice even. Don't risk it. I even saw a student that did an exam and lost, and I never seen her, she never been in the course, but lost all her 3 attempts, and the student was crying to me saying like, what can I do now? I'm trying to hire a lawyer to get a 4th attempt. You know, why put yourself in that situation? Okay. And another question to ask yourself that I ask myself a lot as well is, what do you value more, time or money? What's more valuable to you? Make the wise decision. Do you want to put a small cost now, right? 4,000 to 5,000. 5,000 right now is not a major cost over the whole thing you're getting yourself into, right? The whole process is going to be 60,000. So if 5,000 is already a lot, then you're probably not ready for this whole journey yet. But a small cost now for a course now will help you reach your goals faster, become a dentist faster, and then you make it up really quickly. It is worth it. It will buy you 6 months, right? Each fail, this is how you want it. Each fail, sorry, I spelled fail wrong. Each fail costs 6 months of dentistry in Canada. So you tell me what that is worth to you. Each fail will delay because the exams are separated 6 months apart. Each fail costs you 6 months. And I told you, if you're making, 15, 20K a month, let's say it's 15. So what's 15K times 6? 60 plus 30, that's 90K, right? So each fail is costing you 6 months of dentistry, which whatever that could be for you. If you're working full-time or part-time, it could be less, but it depends, right? So think of that. Why? Because maybe you wanted to save, 5,000, so think of what's wiser. So you could put the small costs now and get yourself that 6 months, buy yourself that investment. This is you, this is your future. Make the right thing, do the wise thing here, right? Or you could save the cost now, risk failing, and you pay that 6 months, right? You're using that 6 months. This is called actually opportunity cost, right? Because you're losing your opportunity to make that back financially. So it's something they talk about like in economics and stuff. So just to kind of keep that in perspective, okay? How to study. Okay. I'm gonna look if there's any. So we have what if a person is financially restricted? You guys offer payment installment plans. We're going to talk about that later as well. What if if there's a really, remember I said you have to manage your finances. So if you are really restricted, then the whole process is probably tough for you right now. You have to work a little bit, get something, figure it out, maybe immigrate, then get some sort of loans. So because you're not only looking at that 5,000, you're looking later on, the exam itself is 9,000 for the ACS, right? And also, what else? The courses and the materials. We have a question. Do freshers also get this oh, that's like a, depends on the clinic, right? So, but yes, if you do fillings, you could, okay, let's say it's 10,000 for full time. Let's just say that. That means you're making 500 a day, right? You know, if you do an MOD on 2 teeth, you bill around 500, and usually you get 40% of that, which is 200. Okay, so if you do 4 fillings a day, you'll make 200, or 5 fillings, right? Depending on how big the filling is, obviously, because it's charged based on surface. So it depends on the clinic. Are they collecting the money? Are they able to collect all the things? Is the person insured? You know, it depends on the clinic too. But that's like, just you making 500 is 10,000. Will give you 10,000 a month if you're working 5 days a week, which is, and again, that's like 60,000. Okay, 60K. Still, which one is the smarter investment? Even if it's 60K, right? Like I'm going with the lowest number. Okay. How much will I earn? I kind of put it out here, so it's pretty, you do the math now. Depending on how many days you want to work and how many hours, you know, offices will let you work, you know, from, if you want, from 8 to 8, you know, it's good for the office and good for you. So it depends on how much you could put in. All right. Okay, so now we're back to how to study for the AFK. You must identify your weak points. Okay, so I guess everybody understands this, but there's a way to do this, right? For example, weak points doesn't necessarily mean the difficult things, right? It has to mean the difficult thing for you, right? For you specifically. So how do you do this? Read, give time to forget, and then read again. So you want this, okay? I follow this strategy. Reading something 5 times over 5 months. So let's say you read something once a month. So 5 times over 5 months is better than reading it 5 times in 5 minutes. Okay, so if you're reading a certain card from the decks, or you're reading our scholar's book, right? You're reading. There's a paragraph here. Okay, you kept rereading it. That doesn't help as much as, okay, read it twice maybe now. Keep moving on. Move forward. Remember the train? Move forward. And then maybe after a week or a month, or you come back and you read it again, and then after you come back. That is better for retaining information than trying to master it from your first read. You could never master it from your first read. You will never remember 100% of what you read on your first time, no matter how much time you spend on it. So if you spend 3 hours on this page, you're not going to remember 100%. Your brain it needs time to build that long-term memory. It needs to sleep. You need to forget it, because another way of thinking of it, you're bringing the information in your brain, right? So information A is coming, it's in your brain now. It's somewhere there. You stored something, but now you need to practice finding it. And that's what we help you do as well with the way we ask questions in pharma. So you need to, and the more you practice recalling the information, the more easier it is to recall the information instantly when you need it, okay? And it's hard to recall information without a trigger. So you need to make a trigger. A trigger means maybe a question or a word. So questions trigger the information, okay? So what I recommend is go through 15 pages quickly, then read them over again. That is better than reading 1 page over and over again. So, you know, go through 15 pages, maybe then go back. A technique I actually used while I was studying is I took 10 cards and I promised myself that I would read these 10 cards once each only. So I'd read once. I already had questions made and things on them. So they were already triggered I already had like little trigger points. So I read them once, and then I come back and review them quickly and see what I remember. And then I would be surprised. Wow, I remember more than I thought from just reading once. So isn't that interesting? What happens is that you read it once. Now, from your first reading, you feel you need to test yourself. So you don't have confidence that you remembered, right? So what you do is you go like, how do I test myself now? Let me read it again. And then you need to put some sort of system to test that you remembered, right? And if you do that with each card, it just takes a lot of time. So what I noticed is that reading it once helped me even with memory. So I don't need to put the system to test, you know? Obviously, you might need to do that a little bit, depends. But what I used to do is read it once, read it once, read it once, and then come back and then test my system, because that way I actually, it just saved time, okay? Creating questions are good triggers as well, okay? So how do you study on your first time? Oh, I'm still seeing a question. How much will I? Oh, I was hoping it looked like how much will I learn in the course? How much will I learn? But also, I answered that question already, the earn one. So how to study first time? Read and you will forget. This is how you have to have this mindset. Okay, don't feel bad about forgetting. You will forget. You will. So read and just know that you're gonna forget some stuff. That's fine. Don't feel depressed. Everybody's like this. Everybody's the same. So since you already know that you're going to forget some stuff, try to read the first reading quickly. Just try to get through it. The first reading is just like getting to know the material. You're just like identifying, you know, what's inside here. What's inside this material. You're just figuring it out. Try to understand what you can. Try to learn it, you know. Okay, this is what, there's a table here about this. Good, I know what this table is now. Something like that, right? Build your table of contents, right? So you're trying to figure out what's inside. Oh, we're learning about cysts, then mucosal lesions, then the mucosal lesions is this and that, right? Okay, now obviously this is if you're not with the course. If you're with the course, the lecture itself is kind of like your first reading, right? Plus understanding it. So the course will speed up the process so much. Now, it's your second time, if you're on your own, now you're going to try to learn again and read, but now you're going to see, oh, let me see, what seems like new to me here? Is there things that I remember, and what things seem like I never read them before? So you want to try to highlight those things a little bit in your head that, oh, this looks new, and you can start creating questions about these new things, okay? So that you could create questions. You go like, okay, well, let me create a question about this sentence here, so that when I see it next time, when I come to this card next time, I'll read the question and see if I know the answer. So a good strategy is that you place a system in your second time, you place an evaluating system. Right? You create this on your second read, so that on your third reading, you don't read, you go straight to the system. This saves so much time later on, okay? Because if you need to read every single time the whole card, plus evaluate yourself every time you come to read, okay, so if the dental decks part 2 took you 8 months the first time, it's just going to take you 8 months the last time as well. The same content is there. It's still going to take you time to read it. And you don't want to review. You need to review. I was able to read the entire decks in 2 weeks before my exam, or 3. Okay. Why? Because I created an evaluating system where, and I eliminated, I'm going to show you what that means, eliminated things so that there's less to read. So I was able to finish the entire decks in 3 weeks with the questions. Okay, what's released? So when you get to your third time, you want to use the questions you created or take a peek at the card and see if you can remember any information. So you're trying to evaluate yourself now. So you're trying to trigger and see, will you remember anything? Now, if there's things you remember here, I think they might have became, I call it raw information or common to you. So let's say penicillin is bactericidal. I mean, I don't need to read that again. I already know that. So I don't need to waste time reading it. So you need to figure out which information you're forgetting and which ones each person, and this is different for each person. So which information you're forgetting, which one it's easy to you now. And you want to cross out things that are easy and pointless and keep the things that you forget so that you can review them on your last reading. This will make your final reading more efficient. So what will our course do for you? Okay, what our course will do for you. We have organized all the information into subjects, obviously. And even within the subject, better than the DECCs, okay? We have understood the information. So we're going to teach you it. You don't have to spend time understanding or organizing. We provide you with organized material and will help you understand it all, the tough concepts that are there, which would have taken you probably days to do it on your own. We also have researched all the questions and we'll tell you the answers with evidence, and we'll tell you the ones that are controversial so you don't waste your time on them. We will help you achieve the 4 readings results much faster. Probably in 2 readings, you'll be able to reach the same results as a 4 reading. Here's an example of one of my cards when I was studying, just to show you what it looks like. You see how I physically crossed out? Okay. So instead of reading, since the primordial cyst arises from a tooth, bud, the tooth will be missing from the dental arch unless the cyst, obviously. So now after I read this the first time, I'm like, this is so obvious. Like, I don't need to read this, okay? Because I already know a primordial cyst arises instead of a tooth. I don't need to read that anymore. So I only come to this card. Instead of reading all of this, I'm only reading this here. Okay, even this became easy, so that's why I'm like, I'm done with that. So when a tooth with a radicular cyst at the A is retracted, the radicular cyst is left behind in bone and is now called a residual cyst. I know that so well, so I don't need to think about this again. I know that, so I crossed it out. So now instead of spending 10 minutes on this, I spend 10 seconds probably finishing this card. Okay. Here's another one, for example. Okay, where I cross out things. For example, this specific lesion, it's more common in males. Okay, well, I have a rule. All tumors are common in males, so I don't need to memorize that. So we give you some of these rules, kind of like that, okay? Crossing things out. Here's how the front of my card look. This check mark means I always get this question right, so I don't need to read the question, okay? I always get it right. I got it right twice so far, so I don't need to read it anymore, waste time. And I took parts from the back of the card and triggered here. Most common odontogenic tumor, most common odontogenic cyst. So I put my hand here and I read the left, so I don't have to. Then on the back of the card, everything is crossed out. Here's another one where sometimes what I do is I take, if there's like 2 sentences from another card that's left, I take it and put it on another card. So now I have this card and I could get rid of the other card. This makes endo, or whatever subject, sorry, if it looks like a stack of cards that's this much, now it looks like it's this much. And that is itself, it helps you psychologically to study. I name the cards. So for example, this card is about dentagerous cyst and Bond's nodules, so but mainly dentagerous. And this helped me eventually organize all the dentagerous cyst cards together and all the cards from the same topic or same concept together. And that helped me also make my material so that it's in the course organized. And then you have to do the same with your questions, with the release questions, okay? Okay, so do the same with the questions. When you have the questions, you want to, if you answered a released question correctly many times, so cross out the questions you keep answering correctly. So the first time, let's say you took it in class, let's say question 72, you took it in class, you answered it correctly, you're in class. Now you went back and you started to study again, and while you're studying on your own, you answered it correctly. Let's say you're reviewing it, I mean, by now I would cross it out, but let's say you're reviewing it one day and you answered it correctly. Okay, that's it, cross it out. At your final review, you don't need to read this question. You just don't, okay? And I'm going to talk about why. There's a confidence trick here. We're going to talk about when we get to confidence, okay? All right, so how do you use the course? We will guide you on how to study. So we will create a study guide for you as well. We've been doing that in the last few courses, and we have it on the website. We'll show it to you as well. We will teach you as much as we can. We'll believe that we are even teaching you at a higher quality than your dental school. Honestly, we think that everything you skipped in your school or things that you couldn't understand, we're going to solve that for you. And also, we have less time to do it. So we're going to help you understand all the things your dental school skipped or ignored. and things that you need to pass. Okay. Our teaching style will accomplish two things: passing the AFK, plus you're going to learn dentistry at a higher level that puts you on par, right? On level with Canadian dentists, or even better, okay? People that take this course become even better with their pharma and stuff than general dentists that are here. So you'll be learning what is important for the exam and also being a dentist. You don't want to be, you know, a dentist that's less than other dentists here. That's not going to be something that you're going to like. You want to be on par. You want to feel like a doctor, okay? And a little motivation here, okay? You may never get another chance to learn these things. This is probably your second chance in your life. Your first chance was in uni. And I know how uni feels. You know, you're all confused. You don't know what's going on. You don't even know what a tooth looks like. And you're still learning step by step. So you get to pharma. You're like, man, this is too hard. I just need to pass, right? Okay, but now you're more mature, right? You're more mature. You probably understand a lot of things. And you're like, okay, I want to... you have another chance on correcting your foundational knowledge, okay? Okay, so take the advantage of this chance. The information in this course is really important for being a dentist. Patients and doctors expect a practicing dentist to know these things, so enjoy it. Like pharmacology, they expect you to know what a cholinergic drug means, okay? You shouldn't be like illiterate in it. You have to know. So take this opportunity to fix what you have with dentistry. Take it, because let's say you pass without a course. Do you think that's good for you? Like, let's say you pass without a course. You will never open a pharma book. Trust me, okay? You'll never, if there's no fear or like kind of motivation behind studying, you will never open a pharma book after. You're not going to go and open a pharmacology book to learn what drugs are and the mechanisms. And you'll always be, I don't know, like an inferior dentist, to be honest. You'll always be an inferior dentist to other dentists, okay? That's why I care a lot about this AFK part, because it's not just about passing. You also need to learn these things. When you get to ACJ, you also even use that information, honestly. Okay, sorry about that. Just a little distraction. So, doctors expect a practicing dentist to know certain things again. So, yes, you could. Again, I think you won't. It's hard to pass, but if you do, I don't think it's a good thing. I think you want to take this opportunity, take advantage of this opportunity. People are going to give it to you. What does that mean? Your family is going to give it to you. They're going to say, "Oh, you know what? You're practicing. You're working hard. Go ahead, take it. We'll help." Right? People are going to allow you to do this now. Okay? They're going to be on your side. Hopefully they're supporting you. You have courses helping you. Take advantage of it to be the best dentist you can as well. If you go past and you're working and you're making money and you come to try to study something, people are like, "Why are you wasting your time? You know, no one's going to be on your side." I mean, they might, but you'll have more responsibilities. Okay. So, doctor, there's a question. Do you provide course only for AFK? Why not ACJ? We provide for both, but this is about AFK because that's the first step for many people. Now, if you're done AFK, we also provide courses for ACJ. We have it actually ongoing right now through our online platform. Okay? Now, this circle is kind of important too. It's something I designed to explain a concept, okay? And this is another way of thinking about what you need in this course. So here you have all the subjects, right? So imagine if you are a specialist in endo, imagine that you know pretty much like up to here in endo, let's just say, right? If you're a specialist in ortho, you would know maybe, you know, a lot of ortho like this. Okay. So what do we want to focus on? Do you think you could actually follow the NDEB references and be an expert in everything? That will take you'll never do the exam, okay? So what we want to do is focus on this green circle, we want to make sure you know the main things you need to know as a general dentist from all the subjects. That is what we call the foundation of dentistry, the core knowledge of dentistry, okay? We're going to build a solid foundation for each subject that gives you potential to expand then in each area if you want to, okay? This is what we want to do. This is the goal. Our goal is not to make you a specialist in ortho or perio or prosto. Now, how do questions come? The questions in the AFK. Well, look, they might come like this. So the star represents where questions are coming from. Most of the questions are from that green area. Do you notice? Most of them. Almost 90% maybe. You will get some questions from those specialty difficult questions area that no one would know, right? Or maybe a specialist will get lucky with it, okay? Now, here are your options. Option 1 is to follow what we're telling you to do, the strategy, focus on the green. And you will most likely pass. Why? Because people don't fail because they get these wrong. People fail because they screw up the green part, okay? Failing due to wrong answers is due to answering an easy or average question wrong, okay? Answering a difficult question wrong, I'm almost sure that it won't cause fail. You will not fail, okay? Because remember, it's a competition. It's a scale system. What does this mean? It means, okay, let's say you answered 80%. Okay? Now, let's say you went to a question and there's a difficult question in the exam. Let's say you answered this correctly. Your mark will go, for example, higher to 85. Let's just say, this is not 100% accurate with the numbers. Now, let's say you got this question wrong. Your mark will probably stay the same, you see? But other people's mark will go higher because it's considered a difficult question. Now, let's look at an easy question. Let's say you answer an easy question correctly. Your mark won't go so much higher because it's an easy question. But if you get it wrong, your mark will go down to 75%, for example. Okay? So this is related to that, and this is related to this. So, and how do they mark what is difficult and easy? By the number of people that answer them. So if everyone answers question 2 correctly, it's considered easy. There's no advantage. You're in a race. You all took one step forward. So you're all the same right now. No one is winning. Right? Let's say there's a really difficult question. Everyone answers. Let's say question 40. Everyone is wrong. Everyone is wrong. So that's considered it's also even because no one took a step forward. Do you understand? Imagine it's a race. It's even. Everybody got it wrong. Now let's say there's a difficult question and there's 5 people that got it right. Okay, they will take a step forward. They'll get rewarded for that. But it's only 4 people out of 1,000, so more people have to pass. So you're not going to get punished for that. But if you get an easy question wrong, ooh, that's bad. Even an average question wrong, because that means probably 50 people moved forward and the other 50 didn't. So I hope this is making sense. An easy question, getting that wrong will cause you to fail. An average question could cause you to fail. But a hard question is not what causes you to fail. That's why it's more important to focus on the green, okay? Now, you may think, well, Dr. Hafez, don't we want to get the highest mark possible? So shouldn't I try to focus on these? It's just not doable. It's not doable. The reason it's not doable is because the next time, the next exam, what if the star looks like this? Okay, so that means now in this exam, they focused on perio, not focused, but they brought a difficult one from perio, one from ortho, patho, infection control, and anatomy. So how do you know in each exam where the difficult, very difficult questions are going to come from? You don't. But you could be 100% sure that all the most 90% of the questions are going to be from this green circle. Okay, 80 to 90% are going to be from this green circle. However, if you want to guarantee all the details about every subject, since you don't know how the star is going to look like, that means you have to expand your horizon all the way up to here. And good luck doing that. Maybe it'll take you 10 years to do your AFK. But right? But it's not the right approach. Okay? So I hope that made sense. Okay, so it's not negative marking. It's mainly that it's a competition. Okay, it's a race. Okay, it is a race. Okay, imagine I have a race and I'm saying you're 100 people and I'm only going to allow 25 to win. I'm only going to take the first 25. Okay, so you're 100 people, right? 1 to 100. Okay, and I'm only going to allow, only going to take the top 25. Okay. Now, if an easy question pops up, everybody move the step, right? And here's the end. Here's the finish line, okay? This is a good analogy, hopefully. Okay, so if out of the 100 people, all of them got an easy question right, they're all going to take a step. Okay, they all took a step. Now, if there's an average question, and half people, average means half almost, right? So the average questions, that means half the people got closer to the finish line and half the people didn't, right? So now you're more likely going to be not part of that 25. Okay, let's say there's a difficult question. And what does that mean? Maybe 2 people got it right. Okay, so that means these guys go forward. Well, that's fine because if those 2 go forward, then there's going to still be 23 spots left, right? So let's say now by the end of the finish line, there's maybe 20 people that got to it. Sorry, not 20. Let's say there's 15 people that got to it. And there's still, 10 people here. Right? And there's probably a bunch here. So you don't want to be behind. You need to be forward. And if you get the difficult questions means less people are going to answer them. So you're still going to have spaces. I hope this makes sense here to you guys. Okay? So you could play this from the beginning. So a difficult question. Now an average question comes. Question 3 is average. So half people get the mark. And maybe a different half gets it. Maybe this guy, okay, this one gets it. This one is here now. Okay. Now maybe you have an easy question. Question 4 is easy. So everybody gets it. Okay, so you see the easy questions don't put you ahead. They don't make you win because everybody's getting the point, right? So that's the issue. And then let's say you get a difficult question, question 5. Let's say this guy misses this difficult question and this one gets it. Oh, now he's tied with them. This one gets it. They're tied. This one doesn't. Maybe this one gets it. Now he's back up tied with these. So this is what I'm trying to say. You have to make sure that the difficult questions are not going to make you fail. And you have to answer the easy ones right or you will fail. And the average ones you have to get right as well. So you have the difficult ones are not the ones that are causing you to fail. Okay? Because not everybody answers them correctly, because if they do, then they're not difficult, right? If everybody answers it correctly. So I'm here to give you my knowledge and experience that I know are important. Okay, that's my job here. I want to teach you and all the instructors as well job. We want to teach you. We want the green area. That's what we believe is the right thing. That's what you need. We're going to help you understand it. Now, I will personally give you some of the red areas that I believe in. Each instructor has their red area that they like or think it should be given. Now, sometimes, okay, this red area, the star area, we will take you there a little bit sometimes, right? We'll take you on a little field trip, guys, okay? Our main school, we want to teach you this, but every once in a while, we'll take you into that dark area and just show you something. And why do we do that? We do that because we know there's a question that came from there, so we want you to know it, okay? Now, you might not have the full comprehension and understanding to link all the dots, but that doesn't matter. So we'll take you there, tell you memorize it, and let's come back. Go, see it, memorize it, come back to the green, okay? That's the game plan here. So only go in details if you see questions asking about those specific details, okay? And we'll always come across new concepts. Dentistry, this is a huge ocean of knowledge, and we're always here to support you. It's impossible to answer all the questions you may have about dentistry, guys. Come on, be realistic. But rest assured, we already know what you need for the exam. We have it prepared, and we want to focus on what you need, not necessarily what you desire, okay, what you want. Sometimes you might have a curiosity. Sometimes you might have a question that's still in your head from second year school that I don't really care about, that doesn't really help you with the exam. So I might not address it, okay? But it depends. We usually research everything for our students, and we cannot compete with Google as well. Like if you're researching during the live sessions or during class, I won't be able to compete with Google right on the spot. So please don't do that. Let me give my material. Then if you have anything to discuss, we could do that later, okay? So that is basically some concepts in class. One of you may know more than me in a specific area, or more than one specific area. Okay, so if one of you is an ortho back home, you might know more than me in ortho. That's fine. But trust me, I'm going to know what you need for ortho in the exam. That's different. Clinical ortho is different than AFK ortho. Now, what I ask is, please don't mention detailed information in class or even in the online sessions, because it'll just confuse others. So imagine I'm teaching, okay? I'm teaching here. I don't know why I look like that, but I'm teaching, and you know, we have you there just listening, trying to learn something in ortho, and then someone behind you just goes like, oh, you know what, this and that, Dr. Hafez, you know, and that about this ortho thing that I've discovered once when I was doing this case, and now I'm like, well, you know, this doesn't really matter for the AFK. And this student, you know what this student's thinking? This student's thinking, uh-oh, do I not know enough? Right? They're scared now. They're like, oh, do I not know enough? I'm probably not doing well enough, right? And we don't want people to feel that way, because they're going to think, oh man, I got to go study more ortho. So it's better to keep that detailed information that is not related to the AFK questions or exam, just to keep it to yourself. If you know something more, I know that you want to share it. You want you have something you want to share, but before you share it in a group session, send it to us first, and we'll see if it's important. So if you have any detailed information that may be in the red area that you want to share, send it to us in an email, then we'll see if it's important for the AFK. Don't share it randomly in class, because it could simply be wrong. That's another thing. Someone could just say something and it's just wrong, right? And then these students may take it, right? They may take it as, oh wait, but now I can't forget what he said or she said. Okay? Or it just may not be important enough, and just confuses and make them feel like they're not studying, right? So if your additional information is not solving some controversial question or adding important knowledge for the exam, then it's better to simply try to ignore it within yourself, or we're just going to ignore it. Because we have limited instructor, classroom or online time is limited with the student instructor. We want to make that part where the students are interacting with the instructors to be focused on the foundational dentistry. Okay, that's what's important for the exam. Now, you're all free to form your own study groups with each other. That's fun. And you could discuss things if you want. But I would still recommend don't go too far. There's always that one student that takes things, too far. They overanalyze and take it too far. So just be careful and try not to be that student. Try to stick within the green area if you can. All right. And one last thing, praise in public, criticize in private. So if you think we've done something wrong, do not mention it during the lecture, because you may be wrong. And it also breaks the flow. So if you have a correction for us, let's say you think one of the questions we answered is incorrect, contact us privately, send an email, send your reference, and then we'll take that into consideration to change it. If we do make a mistake, if we find that something that we made a mistake in, we will correct it and inform everyone. We never hide anything. We're transparent. We're only human after all. So we're open to that. However, we really want that to be first private, because we don't want students to lose confidence in a certain question just because you think it may be wrong, but you may be wrong, right? And we're actually right. So we don't want to create a debate if it's not necessary. Support each other, but don't neglect yourself. And what I mean by that is I do encourage spread of knowledge. We also have a Discord channel. I don't know if all of you know what Discord is, but it's an area where you guys could go in and discuss things, even without instructors. So you could form online groups, kind of like WhatsApp, but better, in my opinion, because you could, easily drag images, discuss openly. The content stays there forever to see if you need, and you could just jump in, and you could split it into several groups, like subgroups as well. So because a lot of people in COVID times, it's more difficult to form those groups, we created somehow a method for you to do it online. However, remember, this exam is a competition. So try to support each other and be on the same team if you're taking the course together, and care for your classmates, because it's good to have teammates and helpful people helping you out. But try not to share a lot with people outside the course. And I'm not saying that just to be mean, but it is up to you at the end. But you're harming yourself. Remember, they're your competition. Remember that they may not share the same with you, and they may pass and you may fail, right? If you guys are taking the course together, you already have the same knowledge. So try not to compete with each other. Try to help each other. But people outside the course don't have that knowledge. So if you're helping them and they're getting more knowledge from somewhere else, right, then they're going to be probably on an advantage. Why help people that didn't make the sacrifice, didn't make the effort, didn't put forward the time and effort and finances to take a course? Why help others at this point when you're in the competition? I encourage you to help after, okay? You're responsible for your success. You're the one that needs help right now, okay? You're the one that needs help. Right now, you're the one that needs help, okay? So after you pass the AFK, go ahead, help other people, no problem. I encourage you to do so. But in this case, just stick with the people that are in with your course and try not to share too much outside the course so that you're not improving your competition, because you are in a competition whether you like it or not, okay? All right, so now I am done with that part. Now I'm going to talk to you guys about why we think people fail, okay? Why do people fail? Now, is it knowledge? Do you think it's knowledge mainly? Now, most people fail because they answer average questions wrong, not the hard questions. I already taught you that. So they fail because they missed an easy or average question. So that's why you have to know what most people know. And that's why I said before, the dental decks if you're not taking a course. So we will make sure you know everything that other people know and more. Okay? Some people tend to like to learn things that are like, hidden. That's not a good strategy, because you want to make sure that if there's a question that everybody knows, you're on the team that you know it, okay? Okay, you want to answer all the questions that other people are answering, and you want to answer the questions that other people sometimes are not answering. So if you take this course and you work and study hard and put the effort, knowledge is not the reason you failed. Okay, if you don't take the course, yes, maybe it is. I don't know your situation then. Always have a growth mindset, not a fixed mindset. A fixed mindset means I don't think I could change. I think I am born with my qualities. A growth mindset means I believe I'm born with certain qualities, but I could improve on them. So always don't say I'm bad with pharma, I'm bad with math, I'm bad with this. Believe that you could be improved if you want to, at least better than what you are yesterday. You could become better tomorrow, right? If you follow our methods and instructions, you will pass. Knowledge will not be the problem. So what are other things that may mess you up? Well, why do people mess up simple questions? I think it's these three. Okay, so I try to make some. First is fear and stress, confidence, and expectations. So let's go through these, because this will also be good for your orientation as well. Okay. So someone is asking about our YouTube channel. It's Scholars Dental, one word. So if you go to YouTube and you look up Scholars Dental, you'll find it. Okay. Now, fear and stress. you need the right amount of fear. So fears help to motivate you, right? It pushes you toward studying. So it's a good way, but too much of it will stress you out and block your clarity and judgment and studying ability and make you study in a bad way because you're always repeating the same concept. So how do you manage your fear? Well, think of these concepts. Keep these things in mind. We are all dentists. We are all scholars. We want to enjoy learning the concept that our dental schools never taught. Look at it as an opportunity to learn now. So hopefully that reduces your fear. If you always think of it as a way to become the best dentist you can, it reduces the fear and anxiety. Change your mindset. Learn in order to become the next generation of qualified dentists. Guys, this is on you now, right? The next generation of dentists, they're going to retire. It's on you to become that best dentist. You have to know how to diagnose endo, what drugs are allowed, how to do the proper anesthetics. You need to know the answers. So it's not just about the exam, but you're also, if you think about it, that you're going to have to hold this torch later on of dentistry. Hopefully that makes it more enjoyable and less stressful. And also keep methods to relax, take breaks from studying, family, long walks, events. Life is more than just AFK. You are attending this session, and that's on its own is an amazing first step toward being successful in this journey. Okay. There's a quote I read from not a textbook, from a book, The Alchemist. Not sure if you guys know it, but the fear of suffering is usually, or it's worse than the suffering itself. So your fear of actually failing or being in the exam, that fear of what's to come is just, the fear of it is worse. The fear of the failing is worse than failing. So when you do fail, it's something that happens. It's bad. It is suffering, right? It's painful, but a few days you'll get through it, and then you'll go back to normal. Then you'll develop your next plan on what to do. The fear of suffering feels worse. That you always think is something like really, really tragic and so hard, and that fear, it's unnecessary. You don't need it in your life. Only a little bit to motivate you to study, but you have to try to get rid of it so that you could also be, have clarity to think. And then when it happens, it's just a quote that helps me remember when you're going through something that you're afraid of. Confidence is another one. So confidence, you need the right amount of confidence. Okay. So what does that mean? Overconfidence creates ignorance. If I used to know someone I studied with that used to be like, no, that's it, I'm done. I read it once. But wait, like, don't you want to read, like, that's it? Like, I'm not saying that, but like sometimes they don't even review it at all, or that's it. No strategy, right? So overconfidence, that you just think you know everything, you're done, you'll forget more. Now, lack of confidence, here's the tricky one. People know this. People know overconfidence. Don't, study. So don't be overconfident or like egotistic about it. But people fall into this mistake. Why? Because they think this is good. This is a good thing. Overstudying. I believe there is such a thing. Okay. Lack of confidence makes you overstudy. And people think it doesn't matter if I overstudy. Overstudying is good. It's always good to overstudy. No, it isn't. Okay. No, it depends on what you're studying. Or lack of confidence will cause you to unnecessarily read and repeat things that waste time. Okay. So please don't fall into the lack of confidence area. Okay. So if you're reading something, question 1, you got it right. You read it again. Oh, you got it right. Do you know why you're reading it for the 3rd time? Let's not fool ourselves. Why do you think you're reading it here for a 3rd time? It's not because you need to review it. It's because it makes you feel good. Okay. You want to improve on yourself. And what you do is you want to read the things you know so that you feel like, look, I know stuff. I know stuff. I'm doing well. You're fooling yourself. You're wasting time. Don't be afraid to challenge and go to the things you don't know, and only make it that what is you're studying. Okay. Go to the questions that are, cross out the things you know, so you don't need to feel good about yourself in a way that you're just answering easy stuff. Go to the hard stuff and make those easy. That's what you need to do. Okay. So how do you manage the confidence? You have to make a decision on when to be confident. Okay. Here's a really good trick. If you read pathology this week, let's say you have card pathology. Let's say it's from the dental decks and it's card 42. You read it today. Then after 2 months, you come back to it. And let's say you set up some evaluating system, like questions, right? So 2 months pass and you get to it again and you pick it up. Oh, let me see. And you found that you have remembered everything. Check, check, check. Everything is remembered. Okay. Now, here you have to make an executive decision. This means, based on this little clinical anecdotal experiment, that after 2 months, you will still remember it. And because it's your second time or third time, or it's an additional time of reading, actually your memory is going to last longer with it. Maybe 3 months even. Does this make sense? Okay. So you should feel confident. You should be, it's a decision. I'm going to be confident that in 2 months, because I just tried, right? I tried my shortest time going between this card and this time was 2 months. And I still remembered it. Now, I could go longer and see the longest time. Sorry, not the shortest. So maybe one day you could try longer. You could go, oh, let me see what happens in 3 months. Will I still remember it? But at least you know for 2 months you still remember. So what if the exam is right in, 1.5 months? Okay, that means you don't need to even review this card for the exam because you remembered it after 2 months. So you should be remembering it within 2 months, the next 2 months. That's confidence. That is the decision to be confident and not to waste your time reading something that you already know that you remembered. Okay, so it is time to read pathology again. You'll find out what knowledge you remember and what you have forgotten. Okay, so I just explained this, right? So that is what you need to think about. So the things that you forget, have confidence that you will remember them or a portion of them next time you read, okay? And don't assume you're going to remember everything. So don't let your confidence shatter just because you don't remember things. That's expect to forget. During the exam, however, when you're inside the exam, always make the decision. That's it. You be an actor. You're confident. Be an actor that is playing a role as a scientist, dentist. That's the best dentist in the world. That's what you have to be. Assume that you have the knowledge to solve all the questions. Okay, that's how you have to think in the exam. Because sometimes questions are masked with different terms and they trick you. But if you dig into your head, you go like, oh yeah. If you think you know it, you will find the answer. And we'll train you during the course on strategies to solve these. On how you could solve questions without even knowing what the exact answer is sometimes, but you can still solve it. Okay, I tell students before the mocks and before the actual exam, and it's a trick that worked with me in the exam. Imagine this scenario: the NDEB has questions, and they selected you because they need a dental consultant to help them answer these questions. They selected you because you took the Scholars Dental course, and you are a scholar, a scientist of dentistry. Here's another scenario. Imagine the world is ended or something, okay? The world is destroyed a little bit, okay? And we are trying to rebuild it. You are the only dentist that survived. What if you're the only dentist that survived? Aren't you going to give the best answer you can that you think is right? If you think with this mentality, you will have a clear vision when you're a clear mind, a thinking mind during the exam. Okay, so either of these scenarios will help. The third thing is expectation. So one of the questions in the course: will you follow up with each doctor and can tell him or her if he is ready for the exam? That's unrealistic. So, and it's a good time to ask that question because we're at expectation, right? So that's a little bit unrealistic. How am I going to be able to tell you if you're ready for the exam without having any objective information? You have to, the mock exams don't always reveal to you how much you know. I could tell you if you are doing better than others based on the mock exams. So what we do in the mocks is that we give you we take all the results and we classify you based on a range without putting names, but we classify the range. So we put a scale system. The people from 65 to 75%, people from 75 to 85, and then from 95. And we show you how many people got here, how many people got here. And then you yourself could look and be, oh, okay, I look like I'm below average, right? And we'll discuss that with you. But in no way in form are we going to be 100% accurate with saying if you are ready or not. That's impossible. There's people, but most of the time I could tell you that your situation doesn't seem like you're in the best situation to take the exam. For example, we had a student that was on their third try, and they had a death in the family. They went back home to visit. I told them that I don't think you should take the exam because you're not in the best mindset. You need that time to review. They did it. They took the exam and they failed. So there's situations that tell us if you're going to do your best or not. But to pass or not, it's a little bit unrealistic, right? We'll tell you that if we think you're doing well or not. Like, there's no reason. It just seems based on your marks that we get in your quizzes and your mocks, your positioning in the mock. Okay, back to expectation. So you want to have high hopes, but be prepared for realistic results, and this will help you a lot in the exam. So if you see a new question in the exam that's disturbing you, or a difficult question, or something you never heard of, sometimes some students just, they break down because of this. This could break you and cause you to mess up other questions. So we will practice exam strategies during the course. So how do we manage this? First of all, walk into the exam expecting to be confused about 50 questions. Know that there will be questions. Don't assume you're going to go in there knowing all the questions. That's not a good strategy. You're gonna set yourself up to be depressed and shocked. So go in there expecting 50 questions. Everybody that I know that got 90 said that they were unsure about 50 to 60 questions. I was unsure about 60. I got 91. Dr. Hajar was unsure about, I think, 60 as well, or 50 to 60, and she got 90. So it's normal. When you see one of these questions, remember, smile and talk to yourself and say, I'm sure everybody else feels the same way, not just me. This is a hard question, not just for me, for everybody else. And just continue, circle the question, and move on. We'll give you strategies on how to do that in the mocks. And always try to dig into your knowledge to solve the question. Here's a quote I read from a book that is, I think, nice as well. Whenever I meet people who are afraid to try something new, in most cases, the reason lies in their fear of being disappointed. So if you go into the exam thinking you're going to have 50 to 60 questions, not sure of, you won't be disappointed. If you think you're going to go thinking you're going to know all the questions, then you're going to be disappointed, and that's going to mess up your thinking. They are afraid they might make a mistake or get rejected. If you are ready to start your journey, I offer you the same words of advice and encouragement that the mentor that was teaching this person offered me, Rich Dad, when I was learning. Be prepared to be disappointed a little bit. It's fine. You could be disappointed that okay, not all 100% is going to be there that you're going to be confident with. That's fine. Okay, the reason there's few self-made rich people is because people can't tolerate disappointment. Instead of learning to face disappointment, they spend their lives avoiding it. Only fools expect everything to go the way they want. So going to the exam thinking that, hey, I'm just going to go in there and it's all going to be easy. No, that's not how it's going to happen. Expecting to be disappointed does not mean being passive or a defeated loser. Expecting to be disappointed is a way of mentally and emotionally preparing yourself to be ready for surprises in the exam that you may not want. By being emotionally prepared, you can be calm and dignified when things do not go your way. When you are calm, you think better. Right? All right, so manage stress and anxiety as well. Lifestyle is important. Sleep, nutrition, exercise, mindfulness, whatever that is, religious or praying or whatever it is for you. But these are also important. We can help, but we can't force you to pass. You are the leader of yourself at the end, right? And we're just here to be part of your success story. And hopefully we see you there. Okay. Now we are going to give you a little history about the course, just so that it's a more of an introduction about who we are, who I am. And I'm going to do this quickly so that, I don't bore you too much with it. But in my third year dental school, which was University of Damascus, okay, that was 2008 and 2009, I made a decision. My decision was, I just decided and figured out that the dental school itself is not going to teach me what I needed to be a really good dentist. Okay, I just decided that. I figured it out. I understood that high marks in dental school don't equal good dentist either. Okay, you could just work towards marks without really being good at dentistry. So I took my education in my own hands and I created my own path. Okay, so what I did is, first I thought, first of all, I need to learn oral medicine. Okay, I need to learn what is normal, what isn't normal in the mouth. So I did that. After that, I thought that my next step is, people come to the dentist for 3 reasons: pain, function. So function is like if I can't eat, and then cosmetics, right? So I'm like, what's the most thing that everybody will always come for? Some people don't care about cosmetics. Some people don't even have teeth and they can still eat on their ridges and they don't care. But everybody will come for pain. Everybody. So I needed to be good at diagnosing pain. So I went through a lot of pain diagnosis concepts. Then I went through diagnosing and treatment of infections, because that's the worst thing first. Then after I figured this out, whether it's perio or endo, I thought, okay, next step would be restoration phase. So how do I restore? So fillings is something basic everybody learns in school, so I feel like I didn't need to put that in my schedule. But I did feel like I needed to understand occlusion and how to restore a single tooth, then a multiple missing teeth kind of case. So my oral medicine book that I chose was Burkitt's, which was really good in the presentation, I think, and organization. Endodontics, I chose Principles of Endodontics. And I also used books that were related to oral physiology to understand the pain on a deeper level. And that's what I did in my 5th year. So it took me a long time to read the whole book while doing dentistry. Then I came back to Canada because I lived in Canada before. That's why my English accent is kind of, sounds normal. So my family was already here and I studied here a few years. So I came back to Canada in 2011 and 12. That's when I started applying for the NDEB. Then I bought Carenza and I'm like, hey, now it's time to go to perio. And I bought Dawson. I actually bought this when I was in Syria. So I read about all the diseases that could happen here, treatment planning, classification, and I read about Dawson's, understanding occlusion. I kept 1 day a week from textbooks to kind of keep myself interested. Then I thought, okay, now it's time to look for the exam kind of stuff. So I bought Dental Decks Part 2, 10 cards a day, 1 card for each subject. I kept going. It took me 8 months to finish my first read of it. Then I'm like, well, there's this thing called Basic Science, and we are the only course that actually has a full kind of really good section for Basic Science. Because I did one of the most research on basic science when I was studying. So I went through all the basic science things and organized it in a beautiful way for dentistry, not only for dentistry, for AFK and examination and dentistry. So I looked at the cells and tissues that are in the oral cavity, focus on cells of the body, epithelium, and connective tissue mainly. And I have these all topics, kind of even physiology, organized in a nice way. These are the basic science stuff I went through to kind of get all the information. And I reinforced it with some YouTube videos and also USMLE videos. If you guys don't know what USMLE is, it's the medical cap videos or the medical exams for medicine in the US. That's where I learned pharma from. So it was a lot of pharma in there, but what I did is I crossed it with the dental decks, and I took what we need as a summary for a dentist and AFK. Pathology, dental decks part 2 was pretty good. It was a good summary, but as I said, I took the organization that's based on Burkitt's, and I put the dental decks information, and then I reorganized it based on that strategy. And patho, it's all about repetitions, man. So I'm going to help you with that as well. Occlusion, and I got it from Dawson's book, pretty nice. And treatment planning for missing teeth, I got it from Contemporary Fixed, and also how to restore a single tooth. We're going to talk about that. Obviously in the course, a lot more things, but just this is what I was studying at that time. Then I thought dental materials. I collected all the ideas from the Dental Decks Part 2, from Philip's Science and Craig's, plus what was in the questions to make a good organized information. I took the exam. Thankfully, I got 91 in 2013, and it took me a year to finish from 2013. I created these lectures to start with, and I started teaching for a company one of the bigger companies as well. And I found that students really like my lectures. Okay, so I realized that everyone was confused about the same things I used to be confused about, and that my lectures were really helpful for students. So I decided to change in my third year, and now I have the solutions to these problems. So that's great. I felt really nice about that. That it came. There was like kind of a result to all my work. I got my license in 2014, and I started creating more lectures and teaching. And then I took a break from teaching where I wanted to focus on experience. So now you have someone that has this knowledge plus the experience. Not only that, I took a lot of courses during my work time in oral surgery, wisdom teeth removal, implants, occlusion, Invisalign, in IV sedation, nitrous oxide from UFT, medical emergencies from UFT, CBCT implants, and currently I'm doing an ortho course. I'm still practicing. I practice now in Hamilton. I created all the remaining lectures that I didn't finish yet, and some of the other companies still have a hold of some of my lectures. They're teaching them, but there's nothing I can do about that right now. But I still have these, and I prepared a course, my first course in 2017, and I liked it. This is something I like to do. I feel like it's something it's more rewarding for me, and I keep dentistry as well. So I made all my lectures into booklets, so they look like a book instead of printed slides, which makes it a lot more neat. So they look like this, right? So the first book is the basic science book. The second book is where you become the doctor, all right? So that includes pathology, medicine, basically, or medicine, pharma, anesthesia. I feel like that's the doctor book. The third book here is the green book, engineer, kind of like the engineer book. So this is where you learn resto, prosto, ortho, and dental materials. And then the fourth book is the surgical book. Okay, the surgical book is endo, perio, surgery, and x-rays, just because that's where we put it. So combining all those, we call this the foundations of dentistry. So what's our plan and schedule for the actual exam? Okay, sorry, for the course. Our schedule is tailored and crafted and designed keeping the student experience in mind. We're not just doing the schedule based on our free time. We do it and then we make ourselves available. So we have to start first with basic science, guys. Okay, that's what we need to start. So learn it and relate to it. And relate it to dentistry. So we take basic science, then we try to relate concepts to the actual patho and pharma, okay? So that you become scientists. Remember, people here are scientists. They take university first, science, then they go into, into dental school. So like someone here not even taking dental school will know what dopamine is. You need to know what that is. So undergrads, and this is 2 days. And this will help almost all the other parts of dentistry, mainly pharma and patho. So you're a scientist, remember, before being a doctor. Then we get into the medicine stuff. Pharmacology, patient management, pathology, and anesthesia. And this will help you become the doctor, because patients expect you to know these things. You are a doctor before being a dentist. Remember that. A dentist is a higher level. It's a specialty of doctor. That's how I look at it. So don't let anyone tell you other. It's not a doctor is up, okay, and dentist is like a lower no, you're specializing in the most coolest area, the oral and facial area. I feel like that's the coolest area. The anesthesia is interesting. The joint is interesting. There's the only area where you have calcified tissue outside the body, which is the teeth. That's like, no one has that. It's a high specialty, okay? The engineering stuff comes after. Dental materials, you actually learn it in a way that you probably will be surprised when you see it. It's awesome. It's prosthodontics, resto, and then ortho. You'll learn. Here's kind of where you become more of a dentist, right? Because this is the really dental stuff. Then I think as a surgical dentist, you need to know endo, perio, implants, a little bit, oral surgery. And then you could say that you are really a doctor of dental surgery. Doctor of dental surgery, right? Awesome. So just to let you show how our course has been improving from when we first started, we always had lectures, questions, obviously Facebook support. We have a forum now, so that's better than Facebook support. So we don't really do that anymore. Final mock exams, online exams, alumni discounts. But we look how much we've been adding. Now we have online videos recorded. We even have new ones just from a few months ago that are awesome. We're going to show you a live demonstration. We have online forums where you could go and research all the discussions that happen before your course and during your course. We have weekly online quizzes, so many quizzes, okay? Live seminars that we will be using during the course to you know, make sure everything's all right after watching the videos. Installment plans as well. We're going to add that. So we do it for in-class people only. That's how our initial strategy is. However, we are going to start implementing it for online. It just may be different for each. So when we do the installment plan, the benefit of paying full, okay, is that you get all the books all at once, so you could read them ahead. Now, if you pay installment plan, let's say, what we do is for our in-class students, we were giving them the books one at a time. So we kind of give them the basic science book, and then once we start pharma, we give them the pharma book. Then, because it goes with the payment plan system. Okay. Now for online, the strategy we developed to keep things organized and you know, proper is that we would ship half the material in the beginning and then ship the second half afterwards. Okay, so half in the beginning. So the payment deposit would be half in the beginning, and then you could finish the other remaining ones. However, this depends on where you live as well. So if you live somewhere where shipping is really expensive, there may be additional costs for you. If you live somewhere where shipping is manageable, then it depends, right? So this is why we say it's a little bit more complicated for online, because we expand to the entire world. We are keeping it, we have to kind of see your specific situation. So if the shipping is too expensive to your location, then there will be an increased charge for the installment plan, but you still get that option if you want to pay in payment in like installments, basically, right? So it's still a good way. You'll get half the books and half the books, but there will be an additional fee based on where you live and based how much the shipping would be towards you. Now, if you pay in full, the shipping is already included in the price, which is $4,400 plus tax. Okay, so shipping, your initial shipping, is included if you pay the full price. We ship the books to you and all the material. You get also a bag, bag and a notebook and a pen. So we try to ship that as well. And again, that's the price would be around $4,400 plus tax, and it's you could see the payment is online as well. So the shipping is included in that. And if you want to do installments, then we're doing 2 shipments. Then that way we have to charge you for the second shipping. Okay, because only 1 shipping is included inside the $4,400. So that's where the additional cost comes with the installment. Now for AFK, we recommend that. Where's the books? Oh, here. For AFK, so we have AFK and ACJ. Okay. Now ACJ, because it's important to see images, we print it in color. But for the AFK, so we don't charge extra, we will do it black and white unless you want it in color, but there's an extra fee for color. We don't recommend it. You don't need it for AFK. Like, look at the dental decks. The dental decks, they have a little color booklet, but just for pathology. It's not in color, you know what I mean? So any review book really for theory like this doesn't need to be in color, but if you really want it in color, there is the option to add color, and then there'll be an extra fee though. However, the ACJ, it comes included already because it's necessary there. Okay, just letting you know that. So yeah, and shipping is included. We have question days in the live sessions. All right, so let's get to our demonstration. And I won't take too long with this demonstration. I'll show you what the website looks like. Here, how about we finish these? So the online course, finally, it was difficult to get to this point. It took us a few years, but the online course now has everything that the in-class course people get. We're going to show you how the online works and the in-class works. You need to have a membership page, which is free to kind of access the area. Okay, I'm going to show you some classroom etiquette stuff. You know, you could read these, like just about not interrupting and just shouting out answers and stuff like that, right? So that's it for now. Let me show you guys the demonstration. Thank you for attending. Okay. Okay, so let's look. I have the website open. All right, what's going on here? Okay. All right, so do you guys see this? Okay. The tax in Ontario is 13%. Okay, Hajar got it. So it'll come up to around 5,000, somewhere there. Okay, so here is one of our courses. So you can see here, you guys can see my screen, right? So you can see here AFK July, September is coming up. The AFK March people, the mocks, that's where we do it. So this is how the videos, or almost 90% of the videos look like this. The really, really nicely sounding as well. And so here I'm going through the names of pathology, and I do this every once in a while during the pathology, so yeah, you keep it all memorized. This is, so you've clicked here, you guys see this here, and this is all the videos, the AFK program, okay? As you could see, we have videos about how to use the course on YouTube, how to use the forum, schedule. So if you click on this, you'll get the schedule. You can see the schedule. We're still planning when the live sessions will be, okay? So we're planning that. Here's the schedule if you need. We also send you the schedules also, you know, if you go to courses and registration, you'll also find the schedule there as well. So, but AFK study guide, let me show you guys a study guide. It tells you each week goals, what you want to do before the lecture, while you're watching the lecture, and after the lecture. So it's very organized for you. Now, it's not mandatory, but some people like to have some sort of minimum guide. Okay, printing the answer sheet for the mocks. Okay, you want to print these, will make it nicer for you. Self-assessment answers. If the videos are not working, what you could do, here's some YouTube videos again, I said. So what we do is we will activate each week. So this course, this is the July course. Right now they have these videos active, you see? So this is the weekend course. And you'll have one full week to watch these videos, okay? So once the week is over, we close these and then we open the next weekend, okay? So each module, okay, if you go by the schedule, we're here, okay? So you can see each module, right? So the first module is basic science and epidemiology. The second module is pharma, 1 and 2. The third module is pharma. So each module will be open together, okay? So each module will be open for a week, and then closed, and then the next one's open for a week, closed, the next one's open for a week, closed, like that, okay? Until we get to the end of the course. All right, so right now you can see all of these videos are up. This is a lot of content, and we also have the live sessions as well. So now some of these we already have in class recorded. So let me just show you what this means. This is our newly recorded method, like this. Okay, and then we have our other recorded method that we have from previous times, like you know, maybe a year ago, but it's the same content. If you feel better learning from this one, for example. But not all of them have great audio. Some of them do, but this is additional. Some people like to watch the in-class. However, they're both the same. So we think you should choose one of them because you probably won't have time to choose both, okay? Now, For example, the basic science is only in class, but the questions are online. Like the way like this. Sorry, I don't mean to say, but the basic science, their videos are this method, okay. But the audio is good, so we only this one and the perio as well are like that. So some of videos, maybe 10% of the videos are this method only, but most of them you have the option of both. And we find that most students like these ones because these ones, you know, you can see the slides and usually they have the questions are with them. Some of these ones, this style, don't have the question inside the video. So we recommend that you watch these ones, okay, if they are. Now, if for example, basic science is only this method, right? This method. So there's no questions inside it, but we recorded separate questions right after each video. So anyway, you'll get everything that an in-class student would get as using online, and even more if you think about it. You have 2 types of recording most of the time here. Okay, anyway, that's the content for our AFK video section. Okay, you'll get access to this. Plus, you have the quiz center. So in the quiz center, you have a quiz that you want to do before the lecture to kind of just test yourself. Okay. A quiz, and you'll get your mark, but we won't tell you what the right answer is yet. And then after you take the quiz post-lecture, once you do the lecture, you take the quiz again. And then this one will tell you where your mistakes were and what was supposed to be done. Okay. This is good to stimulate your curiosity and improve your memory during the lecture. So taking a quiz before will let you think, okay, well, I don't know what this question is, but when you see it in the lecture course or in the videos, it'll give you that, okay, so the answer to this question is that, bam, memory, right? And then you have another test here at the end of the course, 3 hours to practice time, but it's from the released. There's a final course test just to get a certificate if you want. And then when we get to our mocks, we do our mock exams here. We have 4 mocks, and we're working on recording the videos as well for them. However, the mock is done differently. We do it over Zoom. So you will be proctored. You will be monitored just like an exam. You have a time limit. You have to go in. You have a time limit to leave, just like an online exam. Okay, so you have to go by the rules. Okay, and here is our articles, just if you want some articles, and then here is the forum. Okay, so forum here, you go to the AFK section, and look, you could go and see any. So first of all, we're going to print all the material for you. You even get all the questions, and here you can see the answer keys to all the questions you have. So if you want the answer keys for the basic science, question 1 is A, you'll see the answer key. Okay, so you can see how many basic science questions there are. Okay, 356. Okay, and what we have been doing obviously is this is not the area where you want to see the explanations. This is just to see the answers. So if you want to see an explanation, what you do is you go back to the AFK. You don't go to answer keys. You go to the basic science section, and you'll see that, oh look, someone posted question 116. Someone asked about question 302. Oh, what's this? One of our instructors, Dr. Sharif, answered the question here with the explanation. Here's a reference. You see, this is awesome. I love this. Okay, so, and now what you could do is, let's say you're a student during this course, okay, and you're on the forum. What you should do, we have a guide basically on our, let me duplicate this here. Okay, and go to July. So we have this here, how to use. There's a way to use the forum that is acceptable for us. So we'll teach you, learn that here. But anyway, let's say you have a question. You go here, type it. Oh look, someone already asked this question, so I don't need to ask it again. Let me go see what the discussion was. And then you see the reference. Okay, well, maybe I have that question about amalgam that's been bothering me. Oh, look, someone talked about this question. If you find the question you're looking for, question 34. Oh, that's the one I wanted. Oh, why is there no answer? A small percentage. And then You see the discussion with our instructors, okay? So you could post or research. First you have to research, then you could post. If it's not been asked before, then you could post it, and there's a way to post it. It has to be like this. You'll watch that video to get that, okay? And then you have like even our ACJ forums, to give you a little glimpse at it, is pretty, so you can see here our radiology section, for example. You can see, right, you have all these caries. We talk about these radiographs, and then we talk about what the caries are. But that's for another day, guys, for you. Hopefully when you get to ACJ, we'll see you then. But yeah, so you can see there's a lot of work here, 54,000 views, and 4,000 here for ACJ, because it's smaller usually. And let's see, do we miss anything here? I'll show you guys the ACJ online as well, just why not? Okay, and the ACJ Online also has similar content and cases and all that, okay? And you'll learn how to, basically go through x-rays, all right? So you can see here, I'm going through x-rays and I'm talking. So our online is, we're trying to be, and remember guys, the videos, you could make them a higher resolution most of the time. So if it's playing in a low resolution, just make sure you click play, see if there's a higher one, and then put it, okay? Because it might be on the lowest for you, for example. So yeah, that's about this, and you could read about our courses here. This is like our course page. You guys probably know that website already, so I'm not going to go through it. Oh, I told you guys about the alumni discounts. So when you take a course with us, your next course, you get it for cheaper and also for 40% off. And also you could just come back for the mocks. We don't sell the mocks for not our students. And this is where you register. If you want to register, you just go here and you could select the course you want. So here's AFK September. You just go here. I'm going to show you how to download the schedule. You can select if you want color printing. I think just get black and white, to be honest. That's what you should do. And here's a schedule if you want to check it out, okay? Yeah, that's pretty much it for this. I think, did I miss anything, Dr. Hajar, you think? Let's go to AFK. What do you guys think? Any questions?